Semua dah ada dah? Ha? Ada semua?
Dah ada semua, Doktor.
Ya. Siapa presenting?
Saya dan juga Badrul, Doktor.
Angkat tangan. Oh, betul. Sekejap. Okey. Betul lah. Present.
Can I present first, Doktor?
Siapa present dulu?
Saya Dr. Zaki.
Siapa yang present? Siapa yang present? Zaki, you nak present dulu?
Saya dan Badrul akan present.
So, siapa nak present dulu tadi? Siapa? Bazul, boleh present dulu?
Sure, Doctor, I can.
Baik,
Boleh.
Dia dah booking awal-awal, lebih ke dia pula. Sporting ke apa? Okey, present. Present Zaki. You betul-betul apa?
Okay, sorry, I confused just now. So, my patient, 8-year-old Malay girl, presented to the emergency department of HDA 1 year ago with fever for 2 weeks and later diagnosed with hemoglobin E beta thalassemia and currently well and symptomatic, admitted to daycare ward for an elective blood transfusion.
Saya tak faham. Admitted, what is the chief complaint sebenarnya?
The initial chief complaint was fever for 2 weeks.
Dia present before 2 weeks lah.
Okay, Doctor. The patient was apparently well until 1 year ago when she experienced fever for 2 weeks, and the fever was persistent in nature. The mother noticed the fever when her child was warm to touch, but however there was no documented temperature, and tepid sponging was not done, and the fever was not associated with any cheese or rigor. Otherwise, the mother denied any history of cough, runny nose, or sore throat, and there was also no history of abdominal pain, nausea, vomiting, and diarrhea suggestive of abdominal GI tract infection, a dysuria, efficacy, or urgency suggestive of a urinary tract infection, or any presence of swelling on any parts of the body, or loss of appetite or loss of weight, or night sweats. And there was also no history of traveling, recreational activities involving water or eating outside, which may suggest of any source of infection that we can think of. And the fever continued to persist even after the child was given syrup paracetamol, which was available at home. And hence, this made the mother to bring the child to a private clinic to seek for medical attention after 1 week of fever. And she was then given a course of antibiotics for 3 days, but however, the fever did not resolve. And the fever was persistent for 2 weeks, and the mother brought the daughter to the emergency department of HDA to seek for treatment. And during the presentation at the emergency department, full blood count was taken and revealed that the hemoglobin count was significantly low, severely low at 3.2 gram deciliter. And she was then immediately admitted to the pediatric ward, and further investigation was done, and the child was then diagnosed with hemoglobin
Oh,
A beta. Yes, doctor.
your chief complaint until your HOP until the child being admitted. Finish.
Yes, doctor.
Finish lah your chief complaint. You understand or not? Hmm?
Understand, doctor? Yes, until the admission.
Mission finish. You want to tell you want to tell this case. You see, your chief complaint is until the day of admitted. Finish. Your mission finish. Anything you want to tell about the apa ni? This case about in chief complaint. Ada apa-apa lagi?
There were also symptoms that was not noticed before. Only after the diagnosis was made was the mother actually noticed several symptoms upon
Tell lah
further questioning.
apa
Okay, thank you, doctor. So the symptoms were, upon further questioning, that the mother also noticed that her child was having lethargy upon exertion, which the mother mentioned that the symptom occurred and most obvious after the patient play or running. Usually the symptom of lethargy will be relieved by rest for a few hours, and it was also associated with palpitation, but however there is no chest pain. And the child would
Palpitation.
yes, doctor.
Umur dia berapa?
The age is 8 years old.
Okay
But however, the child described the symptoms quite severe because it disturbs her daily activity. But however, it does not disturb her sleep. Otherwise, the mother denied any noticeable pallor, yellowish or bluish skin discoloration, chitinous of skin, rashes, easy bruising or bleeding tendency, suggestive of hematological pathology. And the lethargy was not associated with shortness of breath, weakness, or loss of consciousness. And there is also no known family history of blood disorder that runs in the family or malignancy.
Finish your HOPI.
Yes, doctor.
Anybody have any questions? Badu, any questions?
Upon admission to the HDA, what was the investigation result showing the patient had any, what was the diagnosis was made?
The initial investigation was full blood count made at the emergency department, and he came out with severe anemia, which was 3.2 gram per deciliter. And the further investigation, however, after the admission was...
Any question? Is that it?
Is there any, you said that there, from the family history, there is no any blood disorder, right?
Yes, as far as the mother knows lah, or the parent knows.
Oh, but does any of the family members, such as maybe her sibling, have the same symptom?
No, only her.
Siapa?
Sekejap.
If you don't have any question, I'm going to ask you. You know that.
Yeah.
Definitely going to ask you question.
Okay. So did the patient notice any abdominal distension or any abdominal pain?
No.
Sarah?
So this patient has underlying thalassemia just now.
Siapa Farah?
Saya.
No Farah dulu.
Oh, okay.
No Farah, dia belah kanan muka. No Farah.
Yeah. So about the fever, is it continuous in pattern or is there remitting? What's the pattern?
No, it was continuous in nature. It was not progressive or remitting in any way. It was progressive in nature, persistent in nature.
So one more thing. Is there any history of malignancy in the family?
No, there is no history of malignancy of any blood disorder runs in the family.
Thank you.
Welcome.
Sahmi.
I want to ask, since the fever is 2 weeks, so why maksudnya kenapa didn't come earlier ke?
Initially, the fever was only yes 2 weeks, but initially the patient, the mother thought by giving syrup paracetamol the fever would subside. However, after 1 week, it didn't subside and went to the private clinic and she was prescribed with antibiotics. However, the fever still persists, hence causing the mother to actually brought the child 2 weeks later.
Okay, thank you.
Adeline.
I want to ask, during at the ED, is he being transfused?
Yes, after reviewing the blood result, several investigation was made before the before the transfusion actually taken place, and she was transfused with 1 pint.
Farah.
I would like to ask detailed history on the thalassemia. Whether he is on transfusion dependent or not, whether it is a major or just a intermediate or minor.
It was not known to have thalassemia before.
Because just now Zaki mentioned of underlying thalassemia.
No, she was admitted and then diagnosed with thalassemia after that 1 year presentation.
I see.
Sorry for that if I caused confusion.
Okay.
Noifa. Terkejut Pak.
I want to ask, is this the first episode of prolonged fever?
Yes, this is the first episode of actually having fever more than not more than 4 weeks. There's no previous episode of such episode.
Any other question you want to ask? I will to puzzle this case.
I think we need to dig more regarding the pyrexia of unknown origin. So maybe there's any immune related disorder in the family.
Anything you want to ask? Because,
No, upon further question.
What the cause of fever in this case? Zaki.
Yes, doctor.
What the cause of fever?
I think the cause.
Is it otitis media?
No, doctor. Actually, I on the history actually. No, doctor. Actually, from the history, I actually have gone through the causes of infection.
AGE. You mentioned those things. Is it AGE?
No, doctor. There was no history of nausea, vomiting, or diarrhea.
Huh?
There was no history suggestive of infection from the GI tree.
Have you gone through all the symptoms?
Yes, doctor, just now.
Gone through all the symptoms? Nothing? No sore throat, fever out of the blue?
Yes, doctor. Yes.
How high the temperature?
During the presentation, the temperature was only 38.2, doctor. 38.
Only 38.2?
Oh, no. The temperature was 38.2, doctor.
38.2 for 2 weeks?
There was no documented temperature at home, but however, during the presentation, it was 38.2.
Mother says it's a fever for 2 weeks?
Yes.
Intermittent fever?
Continuous in nature, doctor.
Continuous fever high? The child said any evidence of septicemic shock, septicemia?
Oh, I'm not sure, doctor.
Not sure. Not sure. Is the patient jaundice?
No, doctor. There's no suggestive of any hemolytic anemia or chronic liver disease in this patient.
Why patient got to her, then why patient is anemia or why patient non jaundice?
I'm sorry, doctor.
Why the patient anemic when patient is non jaundice?
It may be due to not hemolytic anemia, but it is low in production.
Huh?
Low in production of red blood
Wait.
cells.
10 years old. Uh, 2 weeks. How long? What is developmental growth of this child?
For the growth of the child,
Starting there.
sorry, doctor.
Starting growth chart there.
For the growth chart, actually, the patient, the height is between the third and 10th centile, but however, the weight is between 25 to 50. 50.
Not so bad lah. Oh. Not so bad.
Yeah, still not
When anybody
considered
notice
as.
the child got some decrease in effort tolerance?
Sorry, doctor.
When anybody notice the child got decrease in effort tolerance?
It was during the 2 weeks that the child actually had.
With
Yes.
child with fever.
Yes.
Fever of unknown cause.
Yes.
Badul, present your case.
Okay, doctor. My case, Irfan, a 1 year and 6-month-old Malay boy, was presented to emergency department of HTAA with complaint of rapid bleeding for 1 day. He was apparently well until 3 days prior to admission when he suddenly developed productive cough, which has been described as chesty in nature. The sputum was clear in color and the amount was about 1 teaspoon for every episode. His mother denied any presence of blood streak in the sputum. The cough was also associated with runny nose with clear discharge. However, there were no abnormal sound of cough such as barking or whooping cough, as well as it's not associated with post-acid vomiting. The cough also was not exacerbated by any triggering factors such as cold weather, dust, pets, or allergen. The cough also not interfere with his sleep. However, her mother claimed that the cough was worsening during early morning. Apart from that, the child also had fever for about 2 days prior to the admission. However, there was no documented temperature at home. The fever was intermittent in onset, and her mother claimed that it was worsened at night. The fever was not associated with any noticeable rigor. The patient was given syrup paracetamol for the fever, and it resolves temporarily, but it comes back again and persistent until the day of admission. The documented temperature at the emergency department was 38.6, and there is no other history to suggest other cause of fever, such as there is no UTI symptoms such as dysuria. There is no abdominal pain or diarrhea, and there is no history of traveling um, or do recreational activity or not from a dengue prone area. 1 day prior to the admission, the child developed rapid breathing, which is sudden in onset after finishing playing at home. His breathing was not associated with any noisy breathing, bluish discoloration of the lip, nasal flaring, or noticeable recession. The mother also noticed that the child started to lose his appetite since the onsets of rapid breathing. He refused to take any solid food as well as bottle feeding. He was only tolerate breastfeeding. The child usually took rice or me for his meal. Her mother also noticed that the child become less active than usual since the onsets of rapid breathing. Upon further questioning, the child had history of sick contact with his sister, which was having upper respiratory tract symptoms. Um, Otherwise, there was no family history of asthma. Apart from her mother having allergic rhinitis, there was no other history of atopy among other family member. There was also no history of contact with a COVID-19 patient or travel to high case area. No previous history of shortness of breath during exertion or reduced effort tolerance, or the mother noticed the child become easily fatigued, or history of leg swelling. Worrying about his condition, his mother brought him to KKJ guiding. He was given nebulizer twice. However, the symptom was not relieved. Blood sample was taken, and the clinic then referred the patient to emergency department HDAA. At the emergency department, the child was given another nebulizer as well as a paracetamol for the fever. He was then admitted to the ward for further management.
Oh. She complain apa tadi?
Rapid breathing for 1 day.
Izzati, what's different between first case, second case?
The difference between the first case and current case is the duration, in which the first case is more chronic compared to this case, which is acute.
Oh, it's only symptom of the first case. How come you say chronic? You already decide chronic because symptom of 2 weeks.
Yes.
Yeah. Acute berapa hari? When you decide chronic? 1 week above. 10 days above.
2 weeks, more than 2 weeks.
More than 2 weeks. This one baru 2 weeks. Tak sampai tak sampai lagi 2 minggu.
Besides that, the difference can be the age of the children.
Wow. Saya pasti senyum dah. Oleh ambil dulu Okay, saya lepas
Okay, so besides the age, for Badrul's patient, there is presence of respiratory symptoms, which require nebulization in KK.
The second case, first case tak ada respiratory symptom.
First case tak ada.
Farah?
Same as Zati, but I won't term it as chronic. It's just the duration of presentation for this patient.
You call it duration or duration dah?
Then also for this case, there is for Badrul's case, this patient has a sick contact with his sister, but for the previous case, there is no sick contact or causes.
Itulah, Samiha.
For the first case, the difference between the first case and second case. For the first case, I would proceed my management with investigation, but for the
I need to ask you the difference between the first case and second case based on the history that you have heard.
Okay. For the second case, I will it need acute management because the patient is.
You mean the first case? First case tak perlu.
The first case we need to do further investigation.
HB berapa first case?
3.2.
Berapa HB berapa Zaki? HB first case. Apa? Tak dengar?
3.2.
3.2, sorry Dato.
Ya, 3.2. You mean 3.2 Syami ke tunggu biar dulu. What's the difference? Banyak. You tahu tak, Syami, come on. Open your mind.
So the second case may suggestive infective in nature. However, the first case may not really suggest so.
Fever due to what?
2-week fever, maybe.
Fever, you don't think is effective cause in the first case?
Initially, yes, but when the Zaki presented, it was 2 weeks fever, and
Okay, due to what? What do you think cause of fever in Zaki case?
it can be due to autoimmune or maybe
Autoimmune disease. Autoimmune disease. Have you excluded dengue or not?
Pardon?
Have you excluded dengue in the first case?
From the history, well, he doesn't really underline about dengue, but however, the it's already 2-week fever, so.
Okay, probably it's not dengue for fever 2 weeks. So you don't think the fever is due to any infective process due to autoimmune? You sure about that? In the first case?
It's kind of more suggestive to non-infective, but I cannot really say.
More subjective. Continuous fever for 2 weeks. Continuous tau, bukan intermittent. Continuous. 2 weeks continuous. Malaria? Can be malaria.
Possible also.
Possible also.
But the fever in malaria is not continuous.
Your colleague tak agree dengan you. Dia kata fever malaria nak continuous.
Oh, the pattern of fever.
Pattern fever. Macam mana dia tahu you tak tahu?
Nervous. Dengan nervous kat.
Nervous? You tengok patient you nervous? Your patient in front of you, you nervous. Mana doktor ni, oi? You're going to be a doctor. You can have to decide according to the clinical symptom. You cannot be nervous. So you don't think how the inflammatory fever looks like? Yeah, you think it's an autoimmune disease fever? How it looks like?
So it could be prolonged fever, and does not when it's progressing, it's not really abrupt fever. And also
you tahu ke you tak tahu ke you cerita je? You know or you don't know?
I don't really know.
You don't know. Zaki.
Sorry. Yes, Doctor.
What you think about different between first case, second case? Tak apa, you present, tak apa. Presenter can exclude. Adeline,
For the first case, we might afraid of the patient having shock due to because the patient is having anemia, and for the second case, we might afraid of patient having respiratory failure.
The first case, macam mana?
for the first case, during the emergency setting, we might afraid the patient is going to be in a shock
Why you
condition.
the patient going to be in shock? Why you see that?
Because of the
Why you worry about patient? Is there any evidence the patient going to be in shock? And what kind of shock you talking about? What kind of shock you talking about?
sorry, Dr. Rasul. I think there's no way the patient can be in shock.
Huh?
I'm confused with I thought the patient is having blood loss.
Why you think the patient having blood loss? What makes you think the patient having blood loss?
No, the patient is not having blood loss.
Huh? Apa?
The patient is not having blood loss. She's just having anemic symptoms.
Patient having anemic symptom. What anemic symptom you talking about in this patient?
Lethargy,
Huh?
lethargy and palpitation.
Lagi? Is the patient shock now?
No.
It's really lethargy. Patient lethargy kan?
Yes.
Then the patient not in shock. Hmm? Hmm? Hmm?
Lethargy is due to anemia, not shock, doctor.
Lethargy due to anemia. You don't think this anemia can cause shock?
I think can.
Can what?
Anemia
Farah,
can.
what you think? Different first case, second case.
So for the first case is a girl, for second case is a boy.
Okay lah. Ifah,
For the first case, it does not resolve with the treatment, which is the PCN. But for the second case, it
the
resolves
first
with
case
the
resolve with the
PCN. Does not resolve with PCN. The first case.
The
But
second
for
case?
the second case, it resolves with nebulizer.
Tapi dia masuk ward juga.
I think for the first case, it needs further intensive investigation.
But the second case pun, though you resolve with nebulizer, is still admitted to the ward. The child still need to be admitted to the ward.
Not sure,
The first case using nebulizer or not?
The first case, no.
Second case?
Yes.
So, finish lah.
Okay, use of nebulizer.
Huh?
Okay, use of nebulizer.
Kenapa you complicated nak fikir tu? What you think you more severe, the first case or second case?
The first case.
Why you think the first case more severe?
Because because it needs further investigation to confirm the cause
You mean
of
the second case cannot die? Let's say you don't give anything. Would the second case die or not?
yes, but it resolved with just the
Let's say
first
you don't
line
give.
therapy.
If the first case you don't give, the second case you don't give anything, would the patient would die or not? So not
Yes,
severe enough.
severe.
So which one more severe? First case, second case? Hmm?
Second is more acute.
Second is more
Acute.
acute. Do you believe or not this case 3.2 for 2 weeks? Can people live with HB 3.2 for 2 weeks? 3.2 is only 30%, 40% of your normal hemoglobin. Can you live in 3.2 HB in 2 weeks?
Cannot.
So which one more severe? First case, second case?
First,
Farah, what you think?
The first one.
Okay, Farah Zulaika. You
First-
know, apa ni? You know. Farah,
First one,
which one more severe?
I think the first case will be more severe than the second one.
You don't think the second case is severe?
I do think that the second case is severe. However,
The second case mild, moderate, or severe?
the second case will be moderate.
Why you say moderate?
Because mother did not notice on any chest withdrawal or any respiratory distress symptom.
True, but your patient tak ada respiratory distress. Takib is not respiratory distress.
only tachypnea,
Huh?
but no other
Nasal
sign such as nasal flare, no chest indrawing, no audible wheeze.
enduring.
Tak ada.
Apa lagi? Dia tajik or not?
Yes.
Then how you assess the severity of the second case? Tell me. What is your parameter assessment of severity?
First,
Farah mana?
First, whether patient can tolerate orally or not. Second, for this patient,
tolerate orally.
he only tolerate with breastfeeding, but not
He
with
tolerate or not on the day of admission? Did the child tolerate orally?
only for breastfeeding.
Breastfeeding.
Yeah. But other diet, he
food he doesn't tolerate. So he tolerate or not tolerate breastfeeding? He reduce tolerate. Cannot eat as usual. Anything else?
On the respiratory
lagi?
respiratory distress.
Apa baca ada berapa parameters buka atau protokol tu?
For this patient, he is in the range of 2 months to 5 years. So ada
First
tachypnea.
parameter apa?
Tachypnea.
The first parameter yang atas sekali.
Severe chest indrawing, tachypnea.
It's not pitch parameter, pitch protocol. That's why it's pitch protocol.
Dalam pitch protocol.
Pediatric protocol. Buka. How you assess severity?
Saya print out, ada kat sini.
You tengok apa? You tengok pada ni lah, pada yang asma tu.
Oh, okay. Ingatkan yang hospital admission tu. So sorry. Severity of acute exacerbation asthma. First,
You use for other
breathlessness.
respiratory distress. The first one apa?
Breathlessness.
Ah. Huh?
When walking, when talking, or feeding.
So the sharp
Upon feeding.
for feeding. Mild to moderate severe.
I think it's
The
just
first one.
moderate.
Kedua.
Talks. So unable to assess since this child only 1 year 6
Tiga. The third one.
Alertness.
Ah.
So this child is alert and conscious.
Alert lah. Badrul.
Yes, Doctor.
Dia taji. Alert. Dia taji but alert. Yeah.
Yes.
Oh, okay. The fourth one.
Respiratory rate.
Takib ni tak? How bad is takib ni? Very takib ni slightly takib ni or ni?
This patient is slightly 44 breath per minute.
Apa lagi?
And then accessory muscle usage or
Ada
retraction.
accessory usage?
Tak ada.
Lagi?
Wheezing, no. Wheezing.
Lagi?
SpO2.
Ada?
Badrul.
From the examination, during examination is 98.
It's mild.
So it's moderate, you think?
Mild.
Mild, tapi dia mild. Takib ni only.
Yes.
Poor feeding.
Yes.
So how about the first case?
First case is
Adeline, how about the first case?
First case is
What you do if the child is having 3.2 hemoglobin for the past 2 weeks? What they can have? What the symptom they can what they can have? What they can develop?
heart failure.
Okay, heart failure. Okay, what the symptom of heart failure this child have? Ada ke tak ada?
Palpitation.
Apa symptom heart failure?
Lethargy upon exertion.
Okay, lethargy, decrease in effort tolerance.
Decrease.
So I got some decrease in effort tolerance. Anything else? Anything else?
And palpitation.
Palpitation is sign heart failure. Palpitation is sign heart failure. True or false? Tak dapat U5. U5 tak dapat sign heart failure. Teruknya lah. You Google kan sign heart failure in children.
Ada 4, Doctor. There is 4 cardinal sign.
Apa?
Tachypnea, tachycardia, cardiomegaly, and hepatosmegaly.
Symptom?
Symptom, decreased effort tolerance, shortness of breath.
Okay, ada shortness of breath in this case?
Tak ada.
Lagi apa lagi? Apa lagi simptom dia?
Paroxysmal nocturnal dyspnea.
Ada?
Tak ada.
Lagi? Apa lagi?
Easily Fatigue,
Ah,
easily fatigue.
adalah this fella. Dia ada history of decrease effort tolerance. Tapi decrease tolerance masa bermain saja, bukan masa berjalan. Apa lagi?
Noticeable swelling,
Ada
especially leg
noticeable
swelling.
swelling.
Tak ada.
Oh. So how bad in the first case? Mild, moderate or severe?
Severe.
Severe, tak ada shortness of breath, tak ada swelling, tak ada ni.
But the anemia is very severe anemia.
Very severe anemia, but forget about lab result. We are talking about the clinical. Clinically, the child is, how bad the child is. Tak ada shortness of breath pun tak ada. Swelling pun tak ada.
Mild.
Axillary fatigue only. Don't you think there's some discrepancy between the HB level and the symptom?
Yes.
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 Tak terfikir je. But in terms of symptom, which one more severe? First case, second case?
Second case.
Second case.
Sakit tak ada apa-apa, cuma takip nip pun tak ada. Budak first case ada takip nip tak?
Tak ada.
Tak ada.
First, second case ada takip nip. So the second case more severe daripada first case. Tapi HB 3.8. Katalah 1 hour lagi lambat admit, would the child can develop heart failure or not? Let's say you delay in admission in 1 hour. Would the child develop heart failure in 1 hour?
Can get acute heart failure.
Is it possible the child develop acute heart failure in 1 hour?
Compensatory mechanism of this child.
Compensatory mechanism. After 2 weeks of compensate, suddenly cannot compensate. Tiba-tiba dia cannot compensate. The child develop heart failure in front of your eyes. Takip ni oxygen. What you have to find in physical examination in the first case? What you want to find? Izzati, apa benda yang tengok first case, physical examination?
Physical examination, nak tengok cardiomegaly.
Alah, lagi?
Dengan hepatosplenomegaly.
Lagi?
Generally nak tengok ada pallor ataupun jaundice.
Expected failure kan?
Any
Unless 3.8 tekan, you 3.8 sudah ada failure ke?
Yes.
Sorry, Doctor.
3.8 should have failure no?
Yes. Yes, Doctor. Yes.
Anything else you want to look in physical examination?
Any phases? Any phases such as thalassemia phases?
Sarifah, do you think you are skeptic this child got like a hypertension or not?
Crepitations.
In this case, if let's take this case, do you think the child going to have capitation or not?
Um,
The first
if
case.
there is underlying chest infection, then yeah.
You see, my question to you is simple, yeah.
Uh-huh.
Do you think you expected the child going to have capitation when you are auscultate this child after
No.
looking for the history?
No.
Why you don't think? Why you don't think that you don't think the child going to have capitation?
Because in the history there are no history suggesting any chest infections,
Such as?
such as cough or runny nose, shortness of breath.
But you're not worried about chest infection, is it? You worry about heart failure. 3.2.
Mm-hmm.
Ah. 3.2, you worry about 3.2 or HB or 3.2 for 2 weeks. Huh? Is it?
Yes.
So you do still you expect that you don't find anything in the auscultation of the lung.
For lung crepitations are not usually found in children.
I mean heart failure they don't
In
get.
heart failure.
In heart failure they don't get they cannot develop pulmonary edema even in children.
Can.
Huh?
Can.
Can develop pulmonary
Yes.
edema or not? So do you think this child going to have capitation or not?
Yes.
Huh? Why you think the child going to have capitation?
If there is uh, heart failure, if the
Okay, I ask question again.
yes.
Do you think this child, if you ask is there the possibility of this child when you ask going to have capitation?
For this child, although we have to be worried of heart failure, but I don't think there would be crepitations, as this child does not manifest other symptoms or signs of heart failure, such as PND or edema or any autopnias or tachypnea.
What is sign of pulmonary edema? Sign and symptom of pulmonary edema.
For symptom of pulmonary edema, patient can have concomitant cough associated with wheeze, especially at night. And then have orthopnea, paroxysmal nocturnal dyspnea.
Is it sign of pulmonary edema? Tosnia proximal ni?
It could be symptom due
Is
to gravity.
it the sign of pulmonary edema is PND and autopnea?
Yes.
Hmm?
Yes.
You sure?
Yes, due to accumulation of fluid in the pulmonary, especially at night.
You know, pulmonary edema is what? Accumulation of fluid engorgement inside the vessel or inside the areola?
Inside the areola,
What is,
interstitial,
what is the symptom of that?
like drowning in own exudate.
Breathlessness.
Shortness of breath.
They will have sign symptom of shortness of breath. Did the child have the symptom of shortness, sign and symptom of shortness of breath? Zaki, what the essence of your case?
Sorry, doctor.
What the essence of your case?
So the essence of my case is
Apa dah ngantuk dah. Challenging lalu you all ni. Tak challenge me at all. What is ni?
so the essence of the case is
Essence of your case in one sentence. Satu sentence dia. Okay, dalam 7-8 word, 10 word
an 8-year-old girl with a history of fever for 2 weeks with no specific cause of infection.
Which one you worry more, fever or anemia?
Oh, anemia, doctor.
You worry more. Do you think about the fever is something to worry about?
As for this case, I think not. I think no.
You don't worry fever for 2 weeks ni?
No.
You don't think, you don't think, you don't worry about fever for 2 weeks. Can severe anemia present with fever?
I think my theory behind why the patient might have fever because of the patient have already thalassemia for quite a while, ever since birth, and the spleen was hyperactive, leading to hypersplenism, hence destroying also the white blood cell.
Or for the last 2 weeks, suddenly become weak ni. And why 1 month ago? Why 2 months ago? Why not 1 year to 6 months ago?
I'm not really sure, doctor.
I'm just asking you because you're theory. So your theory, I try to debunk your theory. Can you? Then would you want to argue to stand on your theory? What's your argument to stand on your theory?
Maybe the level of white blood cell then for the past 2 weeks was actually below the
level of
level.
white blood cell. What related white blood cell and thalassemia?
As I mentioned before, maybe because of the spleen being hyperactive, destroying also the white blood cell, not only the red blood cell.
I mean, in thalassemia, the white blood cell also low.
Not in all cases, but in cases where there is hypersplenism.
Splenism, white blood cell is low or platelet low or HB low? Which one is low? Splenism.
Usually by definition, usually the platelet and the RBC will be affected.
Why is it the white blood cell has to be low? What is the particularity about the white blood cell? He can move to wherever he wants to move. You know the white blood cell. Unlike the blue red blood cell, he cannot move wherever he wants to move. The blood cell have no choice. He has to move wherever the blood move. White blood cell is different. He move where he wants to be move. He can go into the tissue. He can clear the tissue. It's different. It's different from the W. So why is hypersplenism can cause low white blood cell? Sign of white blood cell have hypersplenism, low WBC, true or false?
I would say false, doctor.
So you cannot defend your theory.
Yes, doctor.
So what the essence of your case again?
So my essence is an 8-year-old Malay girl with severe anemia presented with 2 weeks of fever.
Because severe anemia presented with 2 weeks of fever. Can I ask you, if you say severe anemia presented 2 weeks of fever, what's the relationship between the fever and anemia?
Could it be a crisis
of
thalassemia?
You belum dengar ke thalassemia crisis?
Oh sorry, aplastic anemia.
Plastic anemia, what happened in plastic anemia? All the parameter is low, is it? In this case, the only one is low is the RBC. So you think the child is having fever is separate entity, and the child is having thalassemia is another another problem. I mean, the child got two problem or one problem. Is the child got fever, which is one problem. The second thing, the child got anemia is another problem. Accidentally, because the child got fever or something else, suddenly got full blood count, tengok dia punya HB dia low 3.2. Accidentally finding. You think that? Do you think that's the
I think that's possible, Doctor.
Then answer one question. One, what cause of the fever? Second, how long the child having 3.2 hemoglobin like that? And how the child can last that long with that low hemoglobin?
For the fever, we need it does fit we need to still do
Do you know? I mean, you have told me that you don't think it's infective. You don't investigate. You dah 2 weeks fever. There no sign symptom of infection. You mean that the child got another problem, autoimmune problem? The child got another two problem now: autoimmune problem and low HB problem.
Could it be an overwhelming infection that cause reduce in total white cell count?
What cell count low? The HB low ke what cell count low? This case.
Both.
Huh?
Both HB and total white.
How low is the WBC?
Zaki?
Actually, for this patient, the WBC is in the normal range.
Furthermore, the child is well except then decrease in fault tolerance. Tak boleh answer. Okay, let's say we go to just make it simple for you all. This is 10 years old.
8 years old, Doctor.
8 years old boy who are having severe anemia. So what do you think come to your mind?
Could it be an acute or could it be a
What do you
chronic?
think come to your mind?
The causes, Doctor? The causes.
Before that, before the causes, what the question come to your mind?
How long? I mean, the duration of the anemia.
What come to mind? Don't you want to know why the child is having thalassemia, having lower HB?
Yes.
What cause the child having low HB? To answer the question, what the cause of child having low HB, what's the thing you need to know?
The causes of anemia.
All the causes of anemia. Tell me what the possible causes of anemia.
Increased destruction or decreased production.
Now, when we're talking about the causes, we don't ask a pathology. You have to tell me the disease, the possible disease.
So it could be thalassemia.
Thalassemia lagi.
Iron deficiency anemia.
Iron deficiency lagi.
Sickle cell anemia. Sickle
Pardon?
cell anemia.
G6PD deficiency. G6PD.
Dengar apa?
Aplastic anemia.
Plastik lagi.
Late poisoning.
Amanya lah. Google tengok cari cause
Okay.
anemia in children.
This is PD deficiency,
Lagi,
acute blood loss or
lagi,
chronic blood loss,
Leukemia.
infection,
lagi.
Parasitic infection.
Positive versions such as
ascariasis,
Ascariasis or
eh?
hookworm.
Apa?
Hookworm or ascariasis.
Ha?
Hookworm.
Ascaris lumbricoides,
Apa?
Ascaris lumbricoides,
Okey, lagi.
hookworm,
Siapa dah Google dah?
Anemia of chronic disease.
Baca nama, siapa dah Google? Tell me the causes of anemia in these children, in the child. Tell me. Apa? Baca. Baca lah.
Um, the cause of anemia in children, it could be parvovirus B19 infection, iron deficiency anemia, folic acid deficiency, chronic inflammation, or due to the chronic disease such as chronic renal failure, or it can be due to the hereditary causes such as hereditary spherocytosis, T6PD deficiency, thalassemia and sickle cell disease, or hemolytic disease of newborn, or any autoimmune hemolytic anemia,
Tu
and
je.
blood loss.
Tu je. So is your case possible have iron deficiency anemia, Zaki?
From the history, it's not suggestive because the
Well,
patient
nobody asks. Nobody knows about the
diet.
nobody knows about the dietary history because nobody asks. So do you think?
I think no, rather for the nutrition history, the patient is quite nutritionally well fed.
What you mean? Can you tell us the nutritional history?
For this child, currently she takes adult diet such as rice, chicken, eats vegetable 3 times a day, and she's not a picky eater.
Picky eater.
No, not a picky eater.
She take what the iron content food she took.
She took the vegetables and also the
It goes to iron content. Where is it the iron content food? Iron content food, mana? Which food?
Green
vegetables.
vegetables.
Green vegetable, which is more important?
Egg yolk,
Spinach, broccoli.
clam,
Leafy vegetables.
Not the internal organ.
chicken, beef,
Meat, chicken.
Red meat.
Because when you eat when you eat chicken, you eat the muscle. It's a lot of myoglobin there. It's content of iron. Is main. If the child got disease-free deficiency,
No, doctor.
why?
Firstly, because of the gender, because she's the patient is a girl, and secondly, there's no.
There is a girl who had disease-free deficiency mutation. Not common. Not to say none at all.
Yes.
Lagi?
And there's no family history suggestive of GSPD.
Yeah. No family history justice of GSPD.
Yes.
What do you mean by that? Do you have a mutation? Do you need a family history?
Oh, not necessarily. Not necessarily.
Oh. Is GSPD deficiency, what kind of anemia they should have?
Hemolytic anemia.
Your child having hemolytic anemia?
No
Or this-
jaundice.
No, doctor.
Is it jaundice alone? Tell you what are the things that you want to know? Is child hemolytic anemia or not?
Colored urine.
Pardon?
Colored urine.
Did the child have those things?
No, doctor. There's no
No.
symptom suggestive.
Did the child got sickle cell anemia?
I think also no, doctor.
Huh?
Also no.
Why?
Not common in the population.
Firstly, because of the ethnicity.
Population. Would you think that this child 1 in 1,000 case?
Possible, doctor. Possible.
1 in 2,000 case? But the symptom of sickle cell anemia I want to look at. Do you think the child is chronic renal failure?
I think no, doctor.
Why?
For chronic renal failure, usually we will have presentation such as low limb swelling or frothy urine.
Swelling? Due to what?
I'm sorry, doctor.
Swelling due to what?
In chronic renal failure, usually due to the loss, due to hypoalbuminemia.
Hypoalbuminemia? Why they got lower lid swelling in chronic renal failure? Hypoalbuminemia, you're talking about what? Nephrotic?
Water retention. Chronic kidney failure. So maybe the edema is due to water retention.
Yeah, chronic water retention. That's why they got for ankle edema. Why you think your child is you think thalassemia tapi tak ada jaundice? You know that thalassemia is chronic hemolytic syndrome in which many of them present with jaundice. And why you think present only at this age, 10 years? Why can't present earlier?
Could be a HBE disease.
Okay, so why they suddenly become 3.8? You see, thalassemia is a hemolytic disease, is it? Yeah, even whatever E ke apa ke whatsoever, E. So hemolytic disease, one of the signs is jaundice. Why no jaundice? If talking about HBE disease, HB 8 or 9, probably okay lah. Tapi talking about HBE disease, HB of 3.8.
Maybe the clearance system is potent.
Pardon?
The clearance, bilirubin clearance system, especially.
Very good. Wow, the liver work clearance system where?
The kidney maybe.
Why is it that the child doesn't have evidence of extra, extra they have thalassemia facies, thalassemia or not? The place where they produce extra blood. No, because 3.8 definitely they have to produce somewhere else to produce immediately. The 3.8 show that the destruction is more than the production.
Extramedullary symptom.
Extramedullary symptom. Kenapa tak ada symptom? Dia tak ada sign of that. Mother didn't notice.
Maybe there is alpha thalassemia as well.
Alpha thalassemia 3.8, 3.2.
Maybe this patient is actually a transfusion dependent, however defaulted.
No, Zaki said first time. Sure ke result dia tu 3. Tu thalassemia E tu? Entah something else. Makan thalassemia E 3.2, tak ada sign extramedullary, tak ada sign tu hemolytic. And then 3. Suddenly 3.2. Coming 3.2, 3.8. Ke pula?
Doktor, ke ada hepatospleno in physical examination?
Ha?
Ke
Pada?
ada hepatosplenomegaly in physical examination?
Okay, kalau even if the hepatospleno examination is there, would you think that where is it extramedullary first come first in the body? In the liver or is it in the name? In thalassemia, the liver is large because of the more of the where the metabolic destruction, or because they produce more blood. They produce extra blood. Where is it? Another bone, is it?
Bone. Yes.
So they utilize the bone first, and they utilize the face bone, everything first. Is there any within the child having thalassemia facie?
No, doctor.
Then.
Doctor, is it possible because of the fever causing the hemolysis to be actually accelerated in a way?
Fever causing accelerated. You mean the child fever result in the accelerated
Hemolysis.
anemia? You pernah jumpa ke? You pernah jumpa dalam baca? Causes of severe anemia in thalassemia, fever, true or false?
Tak pernah, doctor, sorry.
Now I want you to think about this case, discrepancy of the case. Ke result salah, semua salah tak?
Doctor, I would like to ask a question. So during my third year posting, I've encountered one patient. So he is a HBH disease. And then dia datang dengan severe anemia of 4.9. Lepas tu waktu round, saya tanya doktor tu what could be the cause. Dia cakap maybe it is due to infection. That could maybe due to infection yang suddenly dia punya HB drop. So how can we explain on that?
How can we? You tak tanya dia, tanya I.
Sebab dia cakap infection boleh menyebabkan that sort of crisis punya.
What kind of infection? You tanya dia. Telinga infection ke, cellulitis ke, UTI ke, you tak tanya?
Because patient yang saya club tu, he actually presented with a chesty cough 3 days prior to admission.
You tak, ialah what kind of infection, you tanya dia tak? Dia kata infection can cause, dia cakap ada, kenapa doktor ni? Dia cakap dia, bodoh lah doktor ni, kata. Tekanlah infection can cause crisis. Tak cakap dia macam tu.
Saya terima je.
Terima je. Itulah saya sekarang dia tanya I pula. Memang we know that certain viral infection can cause crisis in thalassemia cases. Certain viral infection. Tapi you have to be specific. What are you talking about? Ear infection, UTI, arthritis, AGE. Not all infection will cause the crisis. For the reason that we don't understand, they produce certain antibody that increase the destruction of the RBC. Now I just want to think, that's all. Okay, the message is for you all is that look the case critically. Just look then for granted. You must ask questions. That's why you learn. And then you have to know where to read. Where this case is, you know that the reading is when you read this case, causes of anemia. You read all causes of anemia, and then then after that you read your patient. You read the book and you compare. So you know this one not, this one not, this one not. You come to the conclusions. You see the fever, your case the fever is just low grade fever for 2 weeks. It's not a high grade fever. Then you know that severe anemia is a hyper metabolic state. Because your body going, because the low, they have every, they are having low they are, because you know the function of the, what the function of red blood cell to be in the oxygen, is it? And your body has to work hard. Your heart rate, your tachycardia and those things, your metabolism, just to produce a lot of compensate the anemia. So they have to, the blood has to run faster, so they can bring adequate oxygen to the cell. So everything become hyper. So you, anyway, sometimes, are you sure the mom feel is a fever or not? Unless the temperature is 39, ada temperature 39, 40 ada sampai? Lagi tak tahu.
No.
The documented temperature is 38.1, is it?
Yes.
38.2. Not very high, but temperature is still high lah. So you keep thinking about your case. You can, then you make the diagnosis like Badrul case. Badrul case is a 1.5 years old boy who's having shortness of breath. The next thing come to your mind is you have to know all the causes of shortness of breath. Then that you can able to tackle your patient. You can clock your after you have your knowledge of shortness of breath, then you can clock your patient. You can try to solve the problem of your patient. If you don't have that knowledge, you cannot. You have difficulty to solve your patient. So the knowledge comes from reading, and also from your internet. Nowadays everything at the tip of your finger, you can Google saja. Okay, any question?
Doctor, pertaining to the infection can cause crisis, where can we actually read on that? Maksudnya ada.
You Google je. Thalassemia crisis, tu anemia crisis in thalassemia infection. Dia keluar lah dalam dia punya internet tu.
Okay.
You Google je, you cari je. Sekarang ni kalau you nak cari dalam buku boleh lama sikit, mungkin 1 hour, 2 hours. Kalau Google 20 minit, 10 minit you dapat dah. Any other question? Sekarang mostly of my search sekarang, I presentation, I tak pergi library dah. I sitting in my room, I Google. Any other question? Last time I remember wanted to present one lecture. It took me dalam 1 month. Because to find the article, go to the library to find the journals. Sekarang no need. I can finish my lecture in 1 week. Because almost all the thing that I want is already inside the, even the outside library, our library got a site reference. You key in everything there. Okay, any questions? Actually, by that you have more time now compared to my time. Because everything now you can get everything by your fingertip. Tapi you have to be serious lah. Lihat tadi satu budak yang marah. You tahu you ada kelas, you pergi jogging. You expected you buat kelas, si jogging tu you buat kelas. You tahu this itu the first thing you must rely in the, kalau you nak berkat dalam belajar ialah kena respect majlis ilmu. You kena concentrate, duduk. Your colleague semua boleh buat nice duduk macam ni, you pula nak pergi jogging, nak buat belajar same time. This not such thing of that. You don't respect the majlis ilmu. Then definitely you tak respect majlis ilmu. You tahu cerita yang Khalifah ni, khalifah siapa tu, makmum lah. Dia jumpa dia dengan apa tu, dia nak belajar tu, dia si khalifah dia pergi sendiri jumpa dengan ulama, duduk depan ulama nak belajar. Ini you nak belajar, you pergi jogging, nak belajar jogging. It tell you the mentality, you not prepared to become doctor, that's all. Any questions? Okay.
Doktor.
I hutang apa lagi tak? I sebenarnya confused dengan apa tu, dengan current, you know, dengan this jadual ni. I betul confused. Dah 3 kali tukar dah for your information. I pun dah tak boleh keep track dah. Tak tahu apa benda yang mana dah. Tu. Okay, events kan tak ada
Ada satu session developmental milestone, Doktor.
Developmental semua kena kemudian, because until now we still discuss how to teach developmental dengan internet.
Okay, Doktor.
We tak tahu macam mana, we don't know how to teach developmental internet. Kita tak tahu macam mana nak present internet. Mungkin kita letak satu patient, satu baby depan you all, depan macam ni agaknya. How far you all tengok sampai sini boleh nampak? Sampai sini boleh nampak tak? Tak tahu. How far you boleh nampak? Sampai sebab kalau sini boleh lah kan, tapi nak ke baby dia tak dekat depan-depan macam ni? Tak tahu. We still thinking, bukan you saja. Ramai we are still try to thinking, formalize how to teach developmental dengan internet. You tahu, because developmental has to be taught face to face. You have to, because you have to really go to the patient, because different patient different. There's no standard approach in developmental, because satu different patient different behavior. Ada yang batu at that time certain patient dia tengah good mood, dia tengah bad mood. Kita tak tahu mood dia macam mana. Ada yang nak playful, ada tak nak playful. So the approach really different. Dan developmental pun ada 4 bulan, 6 bulan, 8 bulan. So it's good. We would prefer to teach you all face to face, so you can really feel about it. So you ask me how to teach developmental ni, I pun tak tahu. I don't duduk di site dan bincang macam mana nak buat. Nanti we after we already have some ideas how to do it, in case if you really cannot come to the face to face, then mungkin we devise or something lah. We don't want to show. So tinggal developmental saja. Okay, the rest I teach you all kalau ada apa after dia face to face nanti. Hopefully frontlineer will get first lah. I will get first injection. You all tak tahulah. Injection bila? Mungkin I don't know how important they think about you all ni. Injection for vaccine ni. We probably end of this year some of us start to be vaccinated. Few of us are vaccinated. Want to be vaccinated for vaccine. So after that I pergi shopping complex. Ini for vaccination tu I pergi apa lagi? Makan, tak pakai mask, jogging. Sorry lah you all Kita I enjoy my life. I enjoy the life first lah. After vaccinate ni, you all duduklah dekat rumah ni. Okay Okay, sudah okay. Nanti jumpa face to face nanti okay
Thank you, Doktor.
Tak sempat nak tanya.
Recorded Okay, Assalamualaikum.
Assalamualaikum.
Okay.